Will insurance cover beta-3 agonists for my bladder? If you're wondering whether your insurance will help cover beta-3 agonists for bladder treatment, you're not alone. These medications, like Mirabegron and Vibegron, are used to manage overactive bladder symptoms. Coverage depends on your specific insurance plan, where you live, and your medical history. Many insurance plans do cover these drugs, but there are some important details to keep in mind. Most insurance providers requiring patients to try other treatments first. This process is called step therapy or prior authorization. Usually, your doctor will recommend starting with anticholinergic medications, which are older and often less expensive. If these don't work or cause side effects, then your insurer might approve beta-3 agonists. Sometimes, insurers place these drugs on higher formulary tiers, meaning they are less preferred and may cost you more out of pocket. Cost is a key factor. Beta-3 agonists tend to be more expensive than generic anticholinergic options. Even if your insurance covers them, you might face higher co-payments or co-insurance. Some insurance plans offer savings programs or discounts through pharmaceutical companies, but these are often limited to private insurance and may not apply to government programs like Medicare or Medicaid. For those on Medicare, coverage for beta-3 agonists is usually included under Part D plans. However, costs can vary based on your deductible, the coverage phase, and whether you hit the so-called donut hole, where expenses can increase temporarily. Medicaid coverage varies by state, and some states may require prior authorization before approving these medications. Formulary placement also matters. Beta-3 agonists are often on higher tiers, which means they are less preferred and can be more costly. Some insurance plans designate certain beta-3 agonists as preferred, which can help reduce your costs. Guidelines from medical authorities recommend behavioral therapies as the first step for overactive bladder. Medications like anticholinergics and beta-3 agonists are considered second-line treatments. Insurance policies often reflected this by requiring patients to try anticholinergic drugs first before approving beta-3 agonists. If one medication doesn't work, sometimes a combination of treatments is covered. Finally, some pharmaceutical companies offer assistance programs to help reduce costs for privately insured patients. These programs can be helpful but usually do not apply if you're on government insurance like Medicare or Medicaid. In summary, insurance can cover beta-3 agonists for bladder issues, but coverage is often conditional. It may involve trying other medications first and could come with higher out-of-pocket costs. To get the most accurate information, it's best to check directly with your insurance provider and discuss your options with your healthcare professional. Remember, everyone's situation is different, so personalized advice is always the best way to go.